we truly need to start thinking about how we change the perception of healthcare. It's not a place to go when you're sick, but a place to go and be well. As such, we need to start to think about changing the environment where people live, where they work, where they go to school, and then lifestyle choices. What we believe is food is medicine. What we put into our bodies, or the lack of food, is really important to determine that length and quality of life. If we want to build a healthier future, you need the patient, the provider, which is us, and you need a payer. And that payer partnership is the most important thing because that's where transformation will happen. And that's when we partnered with WellPoint.
Summit Pacific really understands the needs of their community, and they were able to outreach to us and say, how can you help? And we built that partnership based on trust and knowing that we both have the same mission to really provide nutritious food for our communities. In Grays Harbor County, we know that there is prevalence of high chronic diseases such as diabetes and high blood pressure. Our Food is Medicine program addresses those needs in these rural counties.
We're kind of in a food desert here, so it's hard to find a lot of fresh stuff unless you grow it yourself or unless you know somebody or you find a farmer's market. Most of the food you find around here is in the freezer section, so it's hard to get away from.
We help people of all lifestyles. These patients are able to come in and they get 5 healthy meals from the program. They get to take those meals home, implement them into their daily lives.
My role with the FoodRx program is for them to come and meet with me, talk about their nutrition concerns, and I really think that that's an important piece to the puzzle of the FoodRx program so that they have an opportunity to learn about nutrition.
To have a partner that's willing to innovate, think outside the box, dream a little bit, and being willing to think about what's best for the patient, not just the outcome or how we're going to pay for it, but really what's right for the community. That's the most important success factor for me.
One of the things that I like about this program is that it not only provides nutritious food, but it helps people understand how to make healthy meals for their family. Then, in turn, they are able to then, in the next generation, know how to cook those foods and have an appreciation for the goodness and the nutrition that they bring. The Food is Medicine program is just one piece of our collaboration with Summit Pacific. We've also recently donated a mobile medical van that is increasing access in Grays Harbor County. So that is so important to not only have access to care for primary care physicians, but also have that nutritious food. And that really wraps it up with that whole health approach.